Okay.
Welcome to the Coalition Against Typhoid and Pass Defeat DD session on building climate resilience. Today, we will be discussing integrated solutions for WASH-related disease control. While we give people a few moments to enter the room, I'd like to encourage you to, one, answer the polls. Now, the polls are actually in the Pathable format. So if you can go back there and answer the polls, we'd really appreciate it. That will help us stimulate discussion later on. Also note that we're going to be using the chat function, so you can use it right now. There's just a few of you in that room, but if you can look at people and then go ahead and use the chat function to say hello to the person whose name is above or below yours, because if we were physically in a room together, you would give a polite hello to the person next to you. So please take this chance to share a greeting or introduce yourself. While you are introducing yourselves to others, I'm going to introduce myself. My name is Emily Rand, and I'll be your moderator for this session. I currently lead UNICEF's WASH program in Vanuatu, and living on an island in the Pacific that's currently in a dengue fever outbreak and recently experienced multiple Category 5 cyclones. I am very grateful for this session and this chance to learn from our panelists today. I'm really looking forward to hearing how climate change will affect diseases and how we, as water, WASH, public health, and public health professionals, can improve our programming together. This session on building climate change is sponsored and was organized by the Coalition Against Typhoid and Pass Defeat Diarrheal Disease Initiative. This session was created after practitioners working on diseases realized there wasn't enough dialogue between WASH and others in the public health community on integrated solutions for WASH-related disease control. Bree, can you go ahead and show us our first slide? I don't know, do we have enough people who have already joined? Bree, can you share the first slide? Otherwise, people can go to Pathables and see it, but I must admit that I'm afraid to transfer to a new platform myself. So Bree, let me know if I can see the Pathable slide. That first poll, we basically asked you to answer what your role is. Are you more closely tied to public health, WASH, or something else? I might have to come back to that slide, huh?
Hey, Emily, this
okay.
is Laura. I just sent you the slide via Teams, but I can just say that according to the poll, it is we are at 27% public health, 55% WASH, and 18% other.
Perfect. Okay, so we can already see that this session has already been a success. We have public health, WASH, and other professionals joining us. Great, thank you. So before we start the best parts of this session, I want to go over some ground rules. We have a great topic, 4 amazing speakers, and I don't know how many participants because I can't see that part, but hopefully a few. But we only have 1 hour. So to make the best use of our limited time, we're going to use the platforms given to us to manage questions. First, we have some questions for you, the participants. So again, let me do a plug. It's hard, but go ahead and switch back to the Pathable platform and answer the polls that we posted. We still have time because we're going to be using them throughout this session. Second, you will likely have some questions for us. Now, what we're going to ask, let me just check really quickly. There is a chat here in Zoom. And so you can ask your questions here in the Zoom function rather than in Pathable, just so that we can all stay in one place. Our speakers.
Sorry, the chat's actually been disabled.
Oh, it only shows up for me.
You do have to use there's a chat function in Pathable.
Okay, Well, there we go. You hopefully everyone, all of our participants are technically smart and can put up two screens, one showing us and one showing Pathable, so that then you can put your questions in the chat box there. And it might be hard technically, but maybe our hopefully our panelists will be able to also have two screens and then type some answers into the Q&A. Well, we'll call it the Q&A, but really it's the chat function there in Pathable. Laura, is that correct?
Yes, and I see lots of people are introducing themselves via the chat box, so thanks.
Great. Oh, I'm so glad. Really appreciate that. So to ensure we fit everything in, I also just want to warn you, I might cut people off, and that's okay. We've just got a lot of great materials to go through. So with those ground rules set, let's get started. To help us set the scene for our discussion today, Dr. Danielle Lantang will share a story illustrating the real-world impacts of climate change on disease. Dr. Lantang leads a group at Tufts that seeks to reduce the burden of infectious diseases by investigating and evaluating the efficacy and effectiveness of water, sanitation, and hygiene interventions in low-income countries and humanitarian contexts. She has provided technical assistance to and evaluation of programs in more than 40 countries across Africa, Asia, and Central and South America. Again, as Dr. Lantang speaks, please enter questions for her in the Pathable chat section. So with that, I'm going to turn over to Dr. Lantang.
Hey, welcome everybody, and good morning, good afternoon, good evening. Thanks to the 43 attendees we have here now. It's great to see you all. I'm going to start with a large overview and then end with a story. So just as we know, diarrhea is the third largest cause of death in children under 5 worldwide. And we know that diarrhea does increase with temperature and is related and correlated with precipitation and weather events, different in different places. Based on the data, we know that climate change will increase general diarrhea. On average, we'll see about a 7% increase in all-cause diarrhea per degree Celsius temperature increase, although this can be nonlinear. Now, diarrhea is a symptom. It comes from various pathogens, and actually the pathogens themselves vary in response to climate change. With weather, for example, rotavirus is positively associated with cooler or drier weather, and cryptosporidosis is positively associated with warmer or wetter weather. So each pathogen may respond differently to changes in local weather. And additionally, while some pathogens show decreased survival in warmer waters, indicating there might be decreased disease burden when water temperature increases, other pathogens, for example, Vibrio cholera, exhibit greater survival in warmer waters, which might mean increased disease burden. Additionally, vectors that transmit pathogens can change with temperature. So what we're looking at, as what we're looking at with climate change in general, is overall global climate change will change the burden of an etiology of diarrheal disease. In general, it will increase, but it'll change locally and maybe what pathogen it is. Now, at a regional level, we know that climate and weather impact both hydrology, how much water there is, and this pathogen microbiology. At the community level, hydrology changes water availability in certain places, and pathogen microbiology changes water quality. At the local level, engineered systems, adaptation and behavior, all kind of lead to and adapt with pathogen ingestion, diarrhea, and local morbidity and mortality. So this is a regional climate change, local weather, community level hydrology, pathogen microbiology that will need to be adapted to at the local level with engineered systems, adaptation, and behavior. In particular, with climate change, we anticipate we'll see new waterborne pathogens in areas that did not previously know the disease. And I want to highlight an example of where this happened recently. And while the introduction of cholera in Haiti was directly from an infected person's feces contaminating the waterways and not related to climate change directly, the experience of cholera in Haiti provides a valuable lesson as we plan for introduction of new diseases into new contexts. In Haiti, the combination of an immunologically naive population, a population and medical personnel unfamiliar with the disease symptoms and or how to treat it, and an environment where cholera could easily proliferate and spread led to an explosive cholera outbreak that took a decade to control. With climate change, we anticipate we'll see these new diseases spread and change and proliferate, and we'll need to be prepared to prevent these explosive outbreaks. And that was a general introduction to climate change and health, and I'd like to pass it back to Emily to continue on, and I'm happy to take any questions in the chat.
Thank you so much, Dr. Lanting. That really helps us put into perspective why this session is so important today. And I think there were a few tweetable moments already in there. 7% increase in diarrhea for every 1 degree. Thanks. There's really, really some interesting points in there. So to give us some more data to really understand this topic, Dr. Antar Jutla has pre-recorded a video, which we're now going to show. It really focuses on some of his research on remote sensing of water resources and predictability of infectious disease. So with that, I'm going to turn over to Bree, who's going to upload the video, and Dr. Jutla will then introduce himself in his video.
City of Florida. I am also the director of a geohealth and hydrology lab at within Department of Environmental Engineering Sciences. So today we are going to spend some time on a very broad overview on what climate change can do to infectious diseases, and then how we can basically get to know from a modeling perspective that we can understand the impacts of changing climate on some of the infectious diseases. So before we begin, I want to show you a summary of all the major pandemics that have happened in the world so far. So as you will see from this slide, most of the major pandemics that have happened are either from the bacteria or the viruses. The observation is that the viral outbreaks, the pandemics that have caused by viruses, they tend to have a smaller time than the bacterial outbreaks. Most of these outbreaks, as you will see, the cholera remains one of the major pathogen that has impacted human civilizations for decades and centuries, and even within the pre-mobilized world as well. So for a current one, we have a COVID-19 pandemic ongoing, and the etiological pathways are still emerging for this pandemic. So while this slide doesn't show that this is something that is related to climate, but our previous studies have shown that both the viruses and the bacteria, and more so bacteria, basically respond to the modalities of climatic processes. Our previous work on cholera is one of the pioneering work, which is done by University of Maryland, on how the bacteria has grown, or how bacteria basically responds to both the climate processes as well as the weather processes. If we have to understand that there is going to be, or if we have to assess that changing climate is going to have an impact on emergence of pathogens, and then the pathogens are going to interact with human populations, we need to develop the prediction mechanisms. The prediction mechanisms, or the prediction models that we develop, are then going to be useful to generate scenarios as to, like, what happens under changing climate conditions to the pathogens and to human population, then how the interaction between the pathogens and the climatic processes occur, accelerate or de-accelerate at different locations. So the first point that I want to make is that the prediction or ability to predict the outbreak, which does not necessarily mean that we are going to have a pandemic. The outbreak prediction is extremely critical if we have to understand that what climate or what weather changes are going to do to pathogens. And why do we need prediction? So prediction is, in a sense of infectious diseases, is basically knowing conditions that can lower or that can flatten the epidemiological curve. Either it is the incidence or the prevalence curve. So why do we need prediction? Because we can define the intervention points. These intervention points are going to basically be responsible for reducing the infection burden in human populations. If we know both how the disease can be predicted and then how and where are the intervention points that are going to be located, then we can basically try to understand that how the predictability, how the spread or how the emergence of pathogens occur in a changing climate. So in this figure, what we have is we have two scenarios. One scenario where we have intervention point right when the disease outbreak was starting. So the curve is flattened versus the intervention points when when the disease has already peaked. So we have to basically understand the predictability of pathogens if we have to basically understand that if there is going to be a role of climate or weather on emergence of pathogens. So I'm going to show you a video next. So this video was produced using the hypothesis that we have developed for our cholera. So this video shows that what is going to be the risk of cholera in Africa in 2020s, 30s, 40s, and this model was built based on the data sets that we have collected from 1800s, and then the model was built using that long historical time series, and then basically it's one of the tools that we can use to assess that where the risk of infection of cholera is going to be high. For example, in 2060s, it is expected that the Central Africa is going to be at a higher risk because there will be changes in precipitation and changes in temperatures that basically will increase the chances of occurrence of vibrios in either the coastal waters or inland water bodies. So this is the only reason that we were able to develop these models was that we had a thorough understanding on how pathogen basically evolves in the environment, how it basically interacts with human population under different climatic and weather scenarios. I'm going to show you another video. This video is on YouTube, so I'm going to zoom it out. So this was another example that we have we've built, and that shows that how powerful these models could be if we have to assess the change, the climate change. If you have to understand the climate change on pathogens. So this is the prediction model that was developed for Sudan. So as you will see that the red regions here basically show that that the risk of cholera is high in those locations. So if we overlay this map on a Google Earth or very high resolution spatial imagery, we will be able to pinpoint that what populations are going to be impacted by these diseases, and then where to basically focus on water and sanitation priorities. Because let's be real that the water and sanitation facilities are expensive. They have different sensitivities, both cultural, geographical, political sensitivities. So we have to be very careful as to which regions are to prioritize. For example, in this video, we were able to demonstrate that that there were some water bodies where population was getting water for drinking purposes is probably contaminated with Vibrio cholerae. So now, given that we have this model, given that we have these kinds of risk assessments for a particular pathogen, we can basically extrapolate it to understand what climate change is going to do if precipitation regimes changes, or temperature changes, or water quality parameters changes. So in the end, what we have done is basically we have a framework, and this framework basically summarizes, like, if we have to understand biothreats, we need to have different components come together, and then provide a meaningful holistic assessment on what climate change will do to waterborne, vector-borne, or airborne diseases. So this is something that needs to be done over next few years if we have to basically avoid an outbreak becoming a pandemic. So obviously our grand challenge here is that where is going to be the next pandemic. So in this image, what you are seeing is a Google search. This was done in 2019. And so we were interested to know that what people are searching over internet. So diarrhea remained one of the highest searched word in terms of diseases as per the Google Trends. And this is where the idea of safe water and accessible sanitation is quite critical. So with this, I will thank you, and thank you for listening, and I'll stop here.
Thank you so much, Dr. Jutla. That was really fascinating. It's so amazing to see how far we have come from the Broad Street pump handle being taken off. Now we can almost predict where we're going to need to take where we're going to need to work. It's really interesting. So again, Dr. Jutla actually is having some technical difficulties and so can't join us, but you can still go ahead and put your questions in the Pathable format, and we'll see if he can answer them there or join in a little bit later. But meanwhile, let's keep going forward, and we're going to move to a specific example in Bangladesh. We're honored to have Dr. Zahid Hayat Mahmood with us today. Dr. Mahmood is an environmental microbiologist and head of the Laboratory of Environmental Health of the ICDDRB. He has extensive experience in water microbiology research and has published around 50 publications in high-impact peer-reviewed journals. Now, at this point, I was going to try to show you the slide and the poll answer to the question in one word: what disease do you anticipate might increase in your country as a result of climate change? However, I think we're having trouble switching between screens. So maybe, Laura, you can just describe it really quickly for me.
Thank you very much for the nice introduction. As you know, in 2017, an estimated 1.16 million Rohingya people, originally displaced from Myanmar, have been living in 32 camps in Cox's Bazar district of Bangladesh, and there was an increased demand for humanitarian assistance, including shelter, clean water, and sanitation. Collectively, around 6,000 water points and 50,000 emergency latrines have been built to support the needs of inhabitants of the camps. To ensure safe drinking water for them, we have conducted water quality surveillance and monitoring to identify the sources of contamination in Rohingya camps with the funding of UNICEF. From the surveillance, we found that around 10% of the source and 35% of household point-of-use water samples were contaminated with E. coli. So you can understand that during water collection, transport, storage, and use, secondary contamination may occur. We also screened extended spectrum beta-lactamase producing E. coli isolates from the contaminated samples to investigate the multi-drug resistance properties, and found 47 multi-drug resistant extended spectrum beta-lactamase producing E. coli out of 66 isolates. Our studies were not only limited to monitoring of water quality, but also in other sectors like evaluation of fecal sludge management technologies and disease surveillance in the Rohingya camps in Cox's Bazar. Along with our study in Rohingya camps in Cox's Bazar, we also conducted study on the emergence of E. coli, Vibrio vulnificus, and Vibrio parahemolyticus in the aquaculture reservoir of Bangladesh, and also conducting an assessment of the effects of climate variability, physicochemical parameters on Vibrio parahemolyticus in brackish water, fish, and sediments. We also found disease-causing bacteria such as E. coli, Vibrio cholera, Vibrio parahemolyticus, Salmonella species, Shigella species, Legionella pneumophila in our other studies. Most of them are causing cholera, watery diarrhea, fever, and pneumonia. So altogether, we are addressing challenges in providing local monitoring and surveillance solutions for assessing microbial contamination of water resources throughout Bangladesh, including forcibly displayed Myanmar national camps in Cox's Bazar. Thank you.
Thank you so much, Dr. Mahmood, for that great information on the situation in Bangladesh and specifically with the Rohingya. Before we move on, I think, Bree, were you able to find out how to share that screen so that we can see what diseases
Yes.
other people think? Great, let's see it. Okay, these are all the changes that people expect with climate change that will be coming. So I see flooding in big and green. So that's a good segue for us to move to hear a little bit more from Sibunile Ndaba. Sibo trained as a development economist and banker and is skilled in monitoring market challenges and their impact on small businesses. Since 2016, Sibo has worked for Wrapup and oversees the business component of all water supply and sanitation interventions. Sibo, so we've got that flooding in green. Can you tell us about how flooding has impacted cholera in Zambia?
Yeah, thank you so much, Emily. So owing to the previous speakers, I think we've pretty much got an idea that cholera will be primarily transmitted through drinking water and exacerbated by poor hygiene practices, lack of access to clean water, and poor sanitation practices. So I work in Lusaka, where 70% of the population live in peri-urban areas. Now, most of these people rely on unlined pit latrines as a means of sanitation and often use shallow wells. So we have had a number of cholera cases in this country, with the first cases, I think, being experienced in the 70s. But in 2017, we had our worst cholera case, which saw about 114 deaths occurring, with approximately about 6,000 cases in total. Now, that particular year also saw a rise of flooding because we had heavy rainfall. So because Lusaka, primarily where most of these cases were occurring, it sits on a high water table. So what happens that with the flooding, most of those pit latrines were overflowing, creating an almost instant contamination of groundwater, and it made the situation very, very hard to contain. So we are very much aware that flooding in this case really did exacerbate the cholera cases, notwithstanding the fact that, of course, poor hygiene and the lack of access made it worse. But the fact that there was a lot of rainfall, most of the pit latrines were overflowing, instant contamination, it became quite difficult to be able to contain the cholera cases at that time. Thanks.
Thank you so much, Sibu. That was really interesting, and interesting to see how much cholera has been discussed. Mm-hmm. So now, Dr. Mahmood, let me go back to you. We've seen in the audience poll that climate change will infect various countries, but can you tell us, with Bangladesh's flat topography and dense population and drought-prone areas versus storm-raged coastlines, how do you think climate change will impact your work and the lives of Rohingya refugees?
Thank you very much. Working in a situation where we have to keep in mind the occurrence of all of these natural disasters is always challenging. And things always get harder when we face the same over and over again. Hence, the coastal areas often face unexpected natural catastrophic incidents. This often increases the chance of waterborne disease outbreaks. However, a perfect example is the outbreak of cholera, which often attacks either during or after floods or cyclones. A rise in the sea level and increase of temperature help massively on the growth of the planktonic mass, which is reported to be the reservoir of Vibrio cholera. Thus, The rapid growth of plankton promotes the abundance of Vibrio cholera in the aquatic environment, thereby increasing the chances of cholera outbreaks. A combination of extreme weather events such as flooding, storm surges, cyclones, and droughts, and longer-term phenomena directly related to climate change, such as the sea level rise and saltwater intrusion, are forcing families deeper into poverty and displacement. In this process, Rohingya children's access to education and health services is severely disrupted. Due to the floods, health clinics and tube wells may damage, which is essential for meeting communities' safe water needs. Environmental changes put pressure on financial and natural resources, obstructing the government's ability to maintain balance. Here in the case of Bangladesh, this problem is much more frequent as we face natural disasters repeatedly. Thank you.
Thank you so much, Dr. Mahmood. And thank you also, I must say, for mentioning children and some of the bigger impacts, schooling and financing. This really has a disease impact, but a wider impact as well. So thank you for bringing that up. Now that we have a really good understanding of the problems, I want to transition to and talk more about the solutions. Bree's going to show us the slide, what type of data were consulted in the design of the project you are working on now. And I'm really curious to see this one as the answers. Or Laura, you can maybe describe it for me. Oh, here we go. We've got it. Okay. So a lot of disease data and water safety data used, and a little bit of climate data used to inform programs. Great. Well, we're going to move now and hear Sibu. She's actually part of a program that is using both climate change data and disease data. So Sibu, can you tell us about Wrapup's work targeting water scarce areas and those that are having disease outbreaks?
Yeah, thank you so much, Emily. So before I go into that, I just wish to reiterate that sanitation interventions alone will not be sufficient to achieve disease control, but they do help alleviate climate change impacts. So from experience, we are aware that flooding and water scarcity will both contribute to cholera, since people will revert to contaminated shallow wells where there is a scarcity of water. So I'll talk about two main interventions. One in Kanyama. Kanyama is the largest peri-urban area here in Lusaka, and it happens to be the one that sits on the highest water table as well in the southern part of the city. So even when we do have outbreaks, Kanyama is actually the epicenter. So one of our interventions was being able to address the issue of unlined pit latrines and the fact that people were resorting to shallow wells as a means of water for use, both for drinking and bathing as well. So we introduced the first fecal sludge management project in Kanyama by working primarily with the community to devise a whole new entrepreneur where they were actually emptying pit latrines when they are full, but also driving the agenda of ensuring that a pit is well constructed and is completely lined to avert groundwater contamination. One of the key outcomes of that project is that we're able to demonstrate that it's a workable model, and Lusaka Water Supply and Sanitation Company, who are the mandated service providers for water and sanitation services here in Lusaka, we're able to take that up to the host city under the Lusaka Sanitation Program, where they saw the development of a number of fecal sludge treatment plants in each of the 4 parts of the city, where fecal sludge is being safely managed and disposed of, thereby limiting or at least reducing significantly the impact of groundwater contamination and its contribution to disease occurrence. Another project that we were able to think of, which addresses really the issue of water scarcity, is in the northern part of the city in an area called Chazanga, where we trialed 11 different types of pour-flush toilets, where we're encouraging consumers to actually use water that what we call gray water. So what they use to wash their dishes or anything in excess, to actually use that to flush down their waste. So those are called low volume pour flush toilets, using at most about 2 liters to be able to flush down waste. And this has been very critical, and even that has been scaled up under the Lusaka sanitation program.
Great, thanks so much, Sibanila. I think it's really interesting to hear these good solutions about how you can actually conserve water and address some of the big sanitation needs. With that, I want to ask Dr. Lantang, you've seen a lot of programs around the world. What other programs have you seen that are using data to design programs that address the changing disease patterns that will come with climate change?
I think like has been described by the other presenters, a lot of the work around water, sanitation, and hygiene will be local, looking at local conditions, local behavior, local acceptability. And I think when we think about that from an international perspective, it's thinking about water safety planning or water security planning or sanitation safety planning, and putting that within a framework of thinking through, okay, what are the risks? How can those risks be? How do they turn into, what are the hazards from those risks? And then how do you ameliorate those hazards? And so one of my colleagues, Dr. Gabrielle String, has been doing quite a bit of work looking at water safety planning and what makes water safety planning successful. And to say one of the places that she's seen very successful water safety planning is Fiji and Vanuatu, where there is government and UNICEF support to the communities to both develop a locally appropriate and acceptable water safety plan that meets the things that Sibu is saying, right? It needs to be acceptable to the local community, it needs to fit in, and that then can be used and monitored over time to see how the improvements are going. So I think you can have these larger ideas around sanitation safety planning, water safety planning, water security planning with some frameworks that can be implemented locally with support in order to start planning for the future, incorporating a monitoring aspect. And so that's where I would see there are some places and countries really successfully putting all those pieces together to plan for climate change.
Oh, I'm so excited to hear Vanuatu be mentioned. You knew I would love that. So right now, we're going to actually, while Bree and Laura get together some questions, and also you as panel members, if you think of questions that you have for each other, and Laura goes through the Q&A people have posted, we're going to watch a short video that shares a little bit more about climate change. So take it away with that, Bree. Great, thank you for that water climate change video from Defeat DD. With that, Laura, do you have some questions that that I should be asking to some of our participants, our panel members?
We haven't received any questions yet. Please do let us know. Rick Johnston did post a link that I guess WHO has been working on climate resilient water safety planning. I was wondering if maybe Rick could share any more details, or if anyone is familiar with that, like what's been going into that planning. I'd love to hear more about that.
I bet Danielle can answer that a little bit more, or I would love to, but I'm not going to.
I was going to hand it over to either Rick or Emily, actually. Rick, I think I just allowed you to talk. If you would like to answer that, you clearly know more about what World Health is doing. And Emily, if you're able, it would be great to have your perspective.
Wow, well, I wasn't expecting that. As the Rick, are you allowed to speak? Can you go ahead and speak, Rick? Does your microphone work? Passable? Can you help us? Otherwise, I will just share that in Vanuatu, it's the most disaster prone nation in the world. And as a result, really needs to think about climate change a lot. And so they have been quite early in making sure that the water safety planning happens is really a core function of their national implementation plan for safe and secure water. And as this core function, it actually includes some questions that are specifically about climate change, because from data that researchers like you all have shared, we know how climate change is going to impact Vanuatu, but we actually hadn't been thinking about specific diseases that would impact. So that's why I'm really interested in this session today. But we do know, there'll be more cyclones, well, less cyclones, but stronger. As I said, I've already seen that this year. So Rick, can you speak, or is this speaker not gonna work?
He was saying in the chat that he can't get his mic to work.
Ah, bummer. Okay.
With that, Emily,
go ahead.
This is Antar. I'm so sorry I'm late. So I had a change in passwords today that has to basically reflect on all systems, and it was kicking me out of systems. Okay, I want to share something with you guys. So I'm not sure if you guys, can I share my screen?
Mm-hmm.
I'm not sure if you guys have seen, like, we have a specifically on the Vibrio front, we have a Vibrio's Prediction Hub that we have developed over the last 6-7 years now. This is open to public to comment and to get information. So this has all kinds of Vibrio vulnificus, parahemolyticus, Vibrio cholerae, pathogenic, non-pathogenic, all kinds of information on this website. So it has, like, okay, well, how many infections are we having? What's the cost? Where are we seeing those cases? Where are the samplings being done? So this has like a very rich emerging database on Vibrios. And also we have a live cholera risk viewer, which basically tells us on, right now it's on a country scale, which is basically on some parts of Africa, Yemen, Bangladesh, and in some parts of Latin America, where we produce like a real live risks. So here, if you will, this was done for Yemen. So if you click here, it'll give you like, okay, well, what's the area, what's the risk, and then if you zoom in, and then it'll show you like if the risk is high, if the risk is low, and then so on. I heard somebody from Zambia. So we are producing the risks for Zambia as well. Again, like, it has the climate information in it. It has like all kinds of parameters that impact the outbreak of cholera. So that's something that might be of interest to audience. And if they want to have more discussion, we like I said, like, the portal's open, and they can also request us if they have issues. I'm assuming some overseas users may have issues where ArcGIS licenses are not that common. So just email us. We'll create something from a username for them. AGU just released its flooding report. AGU stands for American Geophysical Union. It released its flooding reports on how it's going to impact communities. It's worth looking at this report and see like how flooding can affect across scales in different parts of the world, and where flooding. So not all the places are going to get flooded. Some places will get flooded. Some places will get dry. So that's going to happen anyways. The last thing is that the issue of climate change. So linking climate change with disease outputs is quite challenging. It's not a straightforward thing to basically link climate change to disease outcomes. We did a study several years ago where we were looking at how the global climate change models, can they basically be associated with, or can we use their outputs to understand where cholera outbreaks will happen more? While we are successful, but we are not there yet where we would want to, reason being like the signal and is quite noisy when we are linking the surveillance cases with the climate change parameters or climate change model outputs. So that's an open field right now. We have a pretty good handle on the large climate and weather processes as to how they will change. But then when you translate that to how it's going to impact diseases, how it's going to impact human behavior, and more specifically to water and sanitation infrastructure, that's an open field right now. There are lots of ifs, nows, and all those kinds of things happening all across the scientific community as of now. For example, I'll give you an example. Several years ago, we published a paper. It was on the warming oceans. This was basically, the idea here was, okay, well, is warming ocean going to be harmful for cholera outbreaks? And what we found out is that actually, when the ocean warms up, then the plankton basically, there is a possibility that plankton in a traditional regions like in Bay of Bengal or in Mozambique Bay, that may decrease actually. But that decrease will lead to a shift of that plankton to other locations like Gulf of Mexico, or maybe to Massachusetts Bay, Cape Cod Bay. So we may see that the pathogens may transition to a new regions. Again, this is speculation right now. Again, the transition from climate change models to how it's going to impact diseases is quite challenging as we speak now. So I'll put all these links in the chat.
Excellent. Yes, you can put them in Pathable where people can easily find them even after the event. Thank you so much for all of those really practical resources. Danielle, let me ask you as well. Do you know of other practical resources that maybe some WASH people aren't using from the public health side?
I think the biggest thing about WASH is we often think about, if you have a place, you think about an intervention. You want to give people safe water, or treat that water, or build a latrine, or teach people to wash hands. The biggest thing that I think WASH that people are working on right now is prediction. So right now it's responsive. There's a lot of response. So the prediction idea and linking to prediction, like thinking about water safety planning, which is about thinking toward the future and planning for the future in terms of risks and hazards. But also there's a new kind of initiative within the WASH sector, which is water security classifications. And this is coming out of the Global WASH Cluster and REACH. And it's about the security of the water situation now and into the predictions for the future. And I think that initiative is starting with the water safety plans, with the sanitation safety plans, with the water security classifications. It's starting to think about, rather than being responders and responsive, to being kind of predictors of what's going forward, and thinking about what Sibo had said about Zambia and what Dr. Mahmood said about Bangladesh, thinking both, okay, what will we use? How do we run the test to see what we will use and recommend in our areas? And I think that's where the sector needs to move to, is doing the response that's needed while thinking concurrently about the future. And that's the relief to development continuum. And I think that's always been a struggle, but I think that's the key place the sector needs to look. And using these public health resources, like Dr. Jutla talks about, I think are going to be an important component as the sector starts looking forward.
Yeah, great. Water safety planning. Well, so in Vanuatu, we do water safety and security planning. So like you said, doing those risk assessments first, and so that you can be prepared and working ahead, not just responsive. I really like those ideas. And Dr. Mahmood also talked about surveillance and the importance of that, so that we get early, like Dr. Jutla's chart had that we need the intervention at the start when we start to realize we're going up a deep climb or some disease is increasing. So sadly, we've almost reached the end of our time, but before we close, I'd like to ask everyone to take a moment and think about what things you'll do this week to improve how disease and climate change data is informing your work. So I think that Bree is going to show us a slide, maybe our last poll here, that showed in your country, how frequently do public health and WASH officials meet? Because I think, as a WASH professional, I will say I learned from this presentation some of what the public health people are doing and some great resources. So let's see how often. Bree, can you share that poll?
We actually did not receive any response to that poll. So unfortunately, I don't have any data to show.
Okay, well, I'm going to assume that that means people aren't meeting enough. Public health and WASH practitioners aren't meeting enough. So what we want to do now, if you feel comfortable, audience members, please type one action that you'll take this week into the chat box to reach out the aisle, meet someone from public health or someone from WASH, or inform your work more with data from disease and climate change. So while you're doing that, what we're going to do is ask each of our panelists, give them 1 minute to share one final thought, or give them a chance to advocate for what they hope your one action will be that you'll take this week. So Sibunila, let me start with you. What advice do you give?
Okay, so just hearing everyone speak and linking it back to the theme for World Water Week for this year, which is building resilience faster, I would say collaborate to build resilience faster. I want to be in a room where there's a Dr. Lantane, Dr. Mahmoud, and in practitioners like myself, where we can actually get the evidence side of things and the practical side of things for a more considered effort. So collaborate to build resilience faster. And I hope that for those who are, for the participants, they can also look at collaborating with someone outside their field to build resilience faster. Thank you.
Dr. Mahmoud, what about you? What lessons learned can the rest of the world take from the experiences in the Rohingya refugee camps and what you've heard here today?
Yeah, thank you very much. When it comes to ensuring safe drinking water for nearly 1 million people within a 13 square kilometer area, it is quite impossible to maintain the groundwater in sustainable condition. To encounter this challenge, the authority has to look for alternative sources of drinking water like natural steam, rainwater harvesting, or treated surface water. Also, effectively manage sanitation and construct and maintain the fecal/treatment plants properly. And at last, vaccination is the first place can prevent these diseases to a greater extent. And also, I would like to tell that periodically decontaminate the spout of the tube oil. This is also important to decontaminate the,
Yeah, really important points. Vaccines and still that WASH practical end to decontaminate tube wells. Really interesting, those two together, public health and WASH. I think that's exactly what we're going for, the organizers were going for in this session. Dr. Jutla, what would you add as your final takeaways that you hope maybe audience members will go do?
I would say reach across the aisle. This is a multidisciplinary field. I mean, talk to people, collaborate more to understand like what or learn like the language the other discipline speaks. I think that's key and that's critical. Reason being, that's how the communication will start. That's how the solutions will come. We have learned over several years now that what engineers think versus what public health officials think, they are in a totally different dimensions, and we need to reach across aisles and then basically say, okay, well, let's talk. So that's, I think, would be critical.
Great. Dr. Lantang, what would you say to that?
I think just to end, what I'll be doing this week is looking at research questions for Ebola, which is something we haven't talked about, but has a climate impact. And so what I would say is right now there's a lot of data and focus on cholera because we know that's being impacted by climate, but it's not just cholera. It's going to be, we think there might be impacts on typhoid, on Ebola, on other diseases as well, and keeping those pathogens of interest in mind as we learn to make the collaborations with the different researchers in each of those different sectors. And so thank you for having me and everybody here today.
Yeah, thank you all so much for joining this session. I hope that we can reach across the aisle and that we'll see each other in the countries where we are working, and that together we'll discuss climate change and how we can really work together to reduce WASH-related diseases. So with that, I'm going to close out, but if there are still questions that you didn't get to ask before, please enter it in the chat in the World Water Week Forum platform, Pathable. That will still be there and will be there for the future. So if you have additional questions, please keep going. I think this session will actually stay live a little bit after the session, so you can still keep answering those questions. So great. Thank you all.
Thank you.
Good luck. Bye.
Thank you. Thank you. Bye. Thank you very much.